So, hello, welcome. Let's wait one more minute and then we will start. Okay, I see a lot of people joining. Let's start. Hello and welcome to our webinar on novel digital data sources for social protection. My name is Dominic Lescazet and I'm an advisor on digital social protection for GIZ in Bonn. We are excited to have you here. Join us on our webinar to explore the use of non-traditional data sources that has become more and more important and in the focus of in the wake of the COVID-19 pandemic. In this context, as well as rising population, the importance and use of digital technology in social protection and their potential role in the broader development agenda has increasingly come into focus around the world. Digitalization offers great potential and can help to make risk protection and poverty reduction more efficient. It offers various and innovative solutions to address these challenges in the long term. Costs can be reduced, services can be customized, faster access can be provided, and program quality can be improved. The pandemic has not only impacted our daily lives, but also challenged the traditional methods of providing social protection to those in need. As governments worldwide ramped up their social protection measures, the search for alternative data sources has become more and more important to ensure efficient and targeted delivery of aid. In this webinar, we will discuss the potential of various digital data sources, such as satellite imagery, mobile phone data, digital finance, and digitized admin data, to reshape the future of social protection. As we dive into these novel data sources, we explore the benefits they bring to social protection systems, for example, better and faster targeting. However, as we embrace the possibilities of digital-driven social protection landscape, it's essential to address the ethical concerns and potential challenges that may arise as well. It is our role to address critical issues such as digital exclusion, data access, privacy, transparency, and fairness to ensure that our joint journey towards a better social protection system remains inclusive and responsible. However, non-traditional data sources will be most effective when deployed as complement to rather than a replacement for traditional methods of collecting data for social protection systems. In our recently published report, we also share fascinating case studies from countries around the world: Chile, Colombia, Costa Rica, the DRC, and Turkey, showcasing real-world application of these innovative data sources. Today, we will focus on Colombia, Costa Rica, and DRC. In conclusion, I would like to thank our speakers today. We have Tim Ohlenburg, a data science and machine learning and social protection expert from the University College in London, and Emily Aiken, a data science social protection expert. A special thanks to Emily, who joined us from California today and woke up very, very early this morning. Thanks a lot. And I would like to hand over to Tim now, and who will present the other speakers.
Thanks for the introduction, Domi. So yeah, quickly a word about myself. I'm currently a PhD student at University College London in the computer science department, and I work on proxy means testing and the targeting of social policies. And I also consult in related areas, digital development and particularly social protection related topics. As part of that, I was lucky to work on this exciting report with Emily Aiken, who I'll introduce in a second. Yeah, we're excited to have you here. It's a great turnout, I see. And So just to say about the session today, we will first give an overview of the report, and then we have three case studies. Three presenters have kindly agreed to join us today to talk a little bit more about their cases, and that should take us through roughly the first hour. Then we are going to do about half an hour of panel questions. So I'll be asking the panelists a few hopefully interesting questions, and then we'll open it up to the audience for the Q&A. So there is a chat for the session, but if you want to ask questions to be considered in the Q&A, please put those into the Q&A box. Yeah, so without further ado, I'd like to ask Emily to present the report. Emily is a PhD student at UC Berkeley, and she already, I don't know if it was her first publication, but Emily, just to give you an idea of the caliber of researcher who we have the fortune to listen to today, got a title page on Nature, which is the dream of every scientist. Emily did that already in her first publication, I think. So she's a top-notch researcher from UC Berkeley, has been working in social protection and targeting for some time, including consultancies for GIZ and Oxford Policy Management. So yeah, Emily, please take it away.
Wonderful. Well, thank you very much for the kind introduction. I'm Emily. I guess I've already been introduced, so I'm not going to say more beyond that. But in case this wasn't already made very clear in the introduction, today's webinar is associated with this report that Tim and I consulted on for GIZ on novel digital data sources and social protection. In fact, if you scan the QR code on the corner of this slide, you will be taken directly to the report. So I'm going to spend the next 20 to 25 minutes giving you basically a quick summary of what we have in the report, but mostly trying to convince you that you should really take a look and read the report in more detail. And you can find it very easily online by visiting this QR code or just with a quick Google. So in this report, what Tim and I tried to do is we first kind of walk through what we see as the 5 main digital data sources that are becoming really relevant to social protection systems: satellite imagery, mobile phone data, web and social media data, digital finance data, and lastly, digitized administrative data. We also go into quite a lot of depth on a number of ethical considerations, like Domi mentioned at the beginning. These include digital exclusion, fairness, bias representation, data access, privacy and data security, surveillance and power dynamics, and lastly, transparency and its relationship to manipulation of eligibility criteria.
Emily,
yeah.
Just to ask if you could speak more into the microphone. The sound is not great. Thank you.
Is it just any better?
Similar.
1 second, I'm gonna.
How's this?
That's great.
Okay. Yeah. Always try to get the fanciest headphones and, you know, the best laid plans. I'm sorry. I hope you were all able to hear about most of what I was saying. At least I was just giving a quick overview of the report. You can see it on this slide anyway to begin with. I was just getting to saying that the most interesting part of the report by far, I think, is the various case studies that we include of real world deployments of these various data sources out in the wild. Today, we're very lucky to be joined by 3 people who will discuss 3 of the 5 case studies that we have in the report with us. So I won't be going through those myself, but they will be discussed later on. And also in the report, we have recommendations and sort of a curated list of further reading that we recommend for people who are interested in learning more about these various digital data sources. So with no further ado, I'm going to jump into giving a quick summary of the report, data source by data source. Starting with satellite imagery. And I think, as Tim mentioned, you know, in my real life, outside of being a consultant, I am a PhD student working on, again, digital data and social protection. And I think in my research, I just see that satellite imagery has huge potential for social protection. And there's been, in the past decade or so, a complete transformation in how just much data is being collected through satellites. So these days we have 2 publicly available satellite data sources that anybody who's attending this webinar or anybody at all could access freely. These are Landsat and Sentinel. These are produced by the US and European space agencies respectively. Basically, these are between 10 and 30 meter per pixel resolution, so they're not super high resolution, and they're updated roughly every 2 weeks. Meanwhile, there's also sources of private imagery that, of course, are, you have to pay for, and they're rather expensive, but these are like super high resolution, up to sub-meter, so under a meter per pixel resolution, and these are typically updated weekly, but even as quickly as every single day. So there is this sort of deluge of super high resolution, both spatially and temporally, satellite imagery that is quickly becoming available. The question is just, what useful information is encoded in these images that could be useful to social protection. And so researchers in the past 10 years or so have shown how effective it is to combine these satellite images with machine learning models, especially deep learning models that are trained to extract information on things like roof types, road quality, croplands, like you can see in the lower image on my slide, access to water, like you can see in the upper image, population density. All of this information is available in satellite images and can be extracted using these powerful machine learning models. So that definitely opens up a lot of opportunity for social protection systems. So I'd like to just quickly identify what I see as 4 key opportunities for satellite imagery. The first, and of course, a very natural aspect, is geographic targeting. And so to the extent that we can observe things like population density, but also things like poverty via proxies like roof material from satellite imagery, we can identify to some extent the wealth of villages just from these images without having to conduct a large survey or small area estimation activity. There's also, as imagery becomes increasingly high resolution, the potential for household targeting, so identifying poor households just from satellite images of the tops of those households, again, seeing things like roof material. Another really cool area of work that's been emerging in just the last couple of years is targeting households via damage detection, so trying to identify households that, for example, have been damaged by a hurricane from satellite imagery and using that to channel resources to those households. I think this was recently piloted by Give Directly. And then lastly, there is a potential for monitoring and evaluation too. So as these satellite imagery data sources become increasingly frequently re-imaged, potentially, especially for large cash transfers or large interventions of other kinds, you could observe the impacts of those interventions via satellite imagery. At the same time, there's a number of key challenges to keep in mind. And so for each data source, I'll try to sort of highlight the opportunities followed by the challenges in the same way. I think when it comes to satellite imagery, the 2 I'm most worried about are first the capacity requirements of the imagery. And that's both sort of machine capacity as well as human capacity. On the machine side, satellite imagery is really big. It takes up a lot of space. It requires, if you're working with imagery for like a whole country, it might require a very large server or working in some kind of cloud environment to be able to process it. And then on the human side, as I mentioned on the previous slide, typically this imagery is being processed through some sort of machine learning, deep learning pipeline. So there's sort of quite a lot of human and data science capacity required to work with the imagery. And then also, if you want to work with the private super high resolution satellite data sources, that's going to be pretty expensive. And so there's still data access barriers. Briefly, before I move on, I wanted to highlight that a large number of programs have already started using satellite imagery. I would say out of all the data sources we're going to talk about today, satellite imagery is probably the most used in practice. These, again, are all sort of pretty recent. The COVID pandemic was really a turning point in uses of digital data sources, including satellite imagery and social protection. But so Togo's Novisi program, which I worked on, used satellite imagery for geographic targeting. Likewise, the STEPKIN program in the DRC, which we're very lucky to have Laura here to talk about a little bit later, as well as Prosperia's ongoing work in Costa Rica. We also get to hear about Prosperia's work today, so those are both going to be case studies that are featured shortly. The Adaptive Social Protection Program in Niger is using a satellite-based water access index to trigger cash transfers when droughts occur in certain regions. And then, as I mentioned, Give Directly in the US has recently been piloting using satellite imagery to inform post-hurricane disaster payments based on damage detection algorithms. So lots of very cool opportunities for geographic targeting and other sort of spots in the social protection delivery chain using satellite imagery. All right, moving on to our second major data source that we cover in the report is mobile phone data. And this is actually what I spend most of my time studying. So I'll try not to dwell on it for too long, but this is definitely the one that I get the most excited about and perhaps know the most about. But the reason mobile phone data is relevant here is that, especially in low and middle income countries, mobile phones are perhaps the chief source of digital data that is available to us. Roughly 67% of the world's population currently owns a mobile phone. 75% of these are smartphone users, but that's, in the whole world. In low and middle income countries, it's a lower percentage of people and a lower percentage of smartphone users. The main type of data for mobile phones that is relevant, especially again in low and middle income countries, is these things called call detail records, or CDR, which is basically the metadata about phone calls that is recorded by mobile network operators in the process of their day-to-day activities. So it's typically information that's kind of what's shown in this table at the bottom of my slide. Things like this caller called this other person on this date at this time. The call lasted this long and it went through this cell tower, which gives you some measure of location. So nothing is recorded about, for example, the content of text messages or phone calls. There's also another type of data that's relevant, which is the data that's recorded by internet-enabled apps on smartphones in the course of their day-to-day activities. I would say this is generally still less relevant in the context of low and middle income countries. Call detail records are definitely the type of data that has been used the most, but I'll cover sort of smartphone and app data actually in the next section on web and social media data. So what are the key opportunities and challenges for mobile phone data in social protection? I think there's sort of opportunities across the delivery chain really when it comes to phones, starting with outreach to potentially eligible beneficiaries. With mobile phones, it's very easy to just outreach via, for example, sending SMS messages. And with the use of mobile phone data, those SMS messages can become targeted. So trying to make sure people in a certain part of the country hear about the program, where people estimated to be in a certain socioeconomic status based on their use of their mobile phone. Phones are also great avenues for intake. So using things like USSD or text-based or interactive voice response, IVR, there are options for running intake platforms directly over mobile phones. And when paired with outreach using phone data and targeted text messages, and then cash delivery via mobile money, it becomes this very powerful pipeline that's a fully phone-based pipeline to run a social protection system. Likewise, in terms of targeting and eligibility determination, phone data has a lot of potential to determine both location as well as economic status for targeting. And because this is like a high frequency data source that's basically updated in real time, it has potential for monitoring and evaluation of how are people using these benefits. For example, if a cash transfer or other benefits are sent, does that get translated into purchasing airtime or purchasing mobile money? And also this sort of potential for high frequency insight into people's well-being. That being said, phone data can be pretty scary, and there's a lot of sort of flags, I would say, to watch out for. The first is that CDR and other phone data sources are held privately by mobile network operators, and so data access requires negotiating with mobile network operators. The second is the privacy and surveillance implications of phone use. So phone data contains private and potentially sensitive information, including information about location traces, contact networks. And so it's very difficult to sort of balance the potential utility against the potential privacy risks of using mobile phone data in this way. And then lastly, and we'll talk about this a lot with sort of all the remaining data sources, there's the concern of digital exclusion, in that people who don't own phones are likely to be the poorest people. And if you determine eligibility or send benefits or target outreach over the mobile phone, they're less likely to be able to access benefits. Two programs to date have really used phone data, sort of the data itself in the social protection pipeline. Togo's Novisi program used phone data to determine eligibility based on estimated economic status using phone data and machine learning. It also used phone data to target text messages in the way I kind of described at the beginning to people living in specific areas, informing them about the program. And then phone data was also used in Stepkin. I'm going to leave it to Laura to talk about that more later on. All right, on to the third data source, which is web data and social media data. I would say of all the data sources we've talked about thus far, this is probably actually the most underdeveloped in terms of its use in social protection systems. But the logic here is similar to the phone data case, which is that, you know, web access and social media usage are becoming more and more pervasive across the globe. By 2030, we're projected to reach roughly 90% of the world's population having access to the internet. And meanwhile, you know, billions of people are on Facebook and other social media platforms. So what kind of data from these platforms is actually useful to social protection practitioners? I would say there's a sort of a wide spectrum of different data types available from these platforms. There's things like search engine data. So for example, Google search trends, which I've shown at the right of the slide, provides information about, you know, what sort of search terms are trending in different areas. There's things like social media data where, for example, Twitter used to provide an API that allowed people to sort of access all the tweets coming from certain parts of the world. I think that API has since been either restricted or discontinued, so I'm not sure if that's still available. And then there's sort of crowdsourced data. So things like Wikipedia is an amazing data source that is free, publicly available, and can easily be scraped and downloaded from the internet. Again, like I said, these haven't, for the most part, been really deployed for social protection to date. But I think there's definitely a few key opportunities here. One is poverty mapping, kind of similar to the previous two data sources. The way you use, you know, the internet might say something about what kind of economic status you're likely to have. Typically, the web and social media data are available kind of at relatively coarse spatial resolutions, but they can be useful to poverty mapping. I think the one area where there really has been shown already to be potential is real-time tracking of mobility during crises. So for example, during conflicts or during natural disasters. And then of course, the web can act as a way to interact with beneficiaries, both in terms of outreach as well as beneficiary management. On the downside, data access, as I mentioned, is pretty challenging for a lot of these data sources. They're held by private companies, and the extent to which those companies provide APIs to access the data is totally up to them. And then, of course, again, the concern of digital exclusion, that as it stands right now, many people don't have access to the internet. And likewise, data representativity, for the same reason, we might worry that the data that's coming in from these social media and websites are, you know, only representing a certain sector of the population and maybe not the sort of poorest people. I just wanted to highlight one important use case of web and social media to date, which is also featured in the report, which is Meta has produced these movement maps that use anonymized information from the Facebook platform to sort of look at what areas people are moving between, especially in the context of crises. So I'm showing here a map that they have on their website from the war in Ukraine, but it's also been sort of deployed during various hurricanes, including Hurricane Maria in Puerto Rico, to inform where resources go following a crisis. So there's definitely some potential here, but I'd say this is really the only use of web and social media data that even is relevant to social protection that I'm aware of to date. Okay. On to the fourth data source, which is digital finance data. I think this one is extremely exciting and likely to see a lot of changes in the next few years. In terms of what we're talking about here, we're talking about sort of any data, I guess, recorded by the financial system, but you can think about bank accounts, digital credit, as well as credit scoring. And then also, of course, mobile money being extremely prevalent in low and middle income countries, as well as other digital currencies. And so I think, especially looking ahead into the next few years, mobile money is becoming increasingly important and is a really interesting source of data that's clearly related to economic status. And then also we have these sort of central bank digital currencies that are becoming linked to national ID systems. You can think about something like Aadhaar in India. I think China has something that they're developing as well. So increasingly we have these sort of digitized currencies and digitized financial records that are very relevant to social protection. On the opportunity side, there's a clear opportunity for means testing. So the more and more as economic information is being recorded in these digitized records, there's a potential to like directly observe income or means via these records to determine eligibility. I think that's pretty far from actually happening, but even now, other proxies that could be useful for eligibility determination are being recorded. And so you can kind of, observe, for example, bank account balances or how much mobile money somebody is using, something like that. Again, like phone data, like these other data sources, there's the potential, because this is a real-time data source, to have rapid reassessment of the targeting criteria and to monitor and evaluate uses of program benefits. On the other hand, I think a lot of the concerns here are similar to the concerns I covered with phone data. The privacy and surveillance implications are major. And I hopefully will hear a little bit about that in one of our case studies later on. Likewise, digital exclusion, we're already, is already outside of social protection reason to be concerned about the large unbanked population in poor countries. And so there's a huge potential for digital exclusion of the unbanked if we're using financial data to determine eligibility or for other spots in the delivery chain. And then I just wanted to highlight algorithmic fairness because that hasn't come up as a concern yet. We cover this in more detail in the report, but there's been a lot of concern that credit scoring algorithms might not be fair for different groups of people. And similarly, if we imagine using these data for things like determining eligibility for social protection, many of the same fairness concerns might apply. A couple of key deployments of using digital finance data in social protection so far. We'll hear in a second about Colombia's CISBEN, which has recently integrated credit scoring data into eligibility determination. Another very interesting case study comes from South Africa's SRD grant during the COVID pandemic, which means tested eligibility for the grant based on the balance of applicants' bank accounts through a partnership with private banks. All right, our final data source is digitized administrative data. This isn't sort of digital data in the sense that you might normally think about. It's not like, fully digital data that's being provided by some company or some source that sort of starts digital. Rather, this is the administrative data that's recorded by government branches in sort of the course of their day-to-day activities, but this information is increasingly digitized. And so to the extent that there is sort of collaboration between government ministries that run social protection systems and other ministries, these data could become very relevant to various parts of the social protection delivery chain. So just to give you a sense of what I'm talking about here, I'm talking about like records of land and building ownership, like vehicle registries, income and asset ownership from tax records, or information about education and health system utilization. All of this information is becoming more and more digitized. It's really a matter of whether it's legal and also whether it's possible to negotiate access to this data between various government branches. I think we have seen a lot of opportunity for this type of data in social protection recently. Again, I'm talking a lot about targeting, but I do think there's opportunities across the delivery chain. But in terms of targeting, there's the possibility to have sort of immediate targeted outreach upon changing eligibility criteria or changing status. So if someone, for example, has a child and that household then becomes eligible for like a child tax credit or something like that, they can immediately be identified and there can be sent some kind of outreach to be told about their new eligibility. Likewise, especially during the COVID pandemic, we saw a lot of use of these administrative records for sort of categorical targeting criteria, or even as inputs to proxy means tests. And then lastly, again, I think I sound like a broken record at this point, but like these other data sources, many administrative data sources are updated fairly frequently. And so there is the potential here for a dynamic reassessment of targeting criteria. At the same time, like with all the other data sources, there's some reasons that this might not work as well as you would hope. For one thing, data sharing among public sector institutions isn't always a straightforward process. And then also it's really important to think about the sort of surveillance and consent implications for using these data that are being collected for one purpose, for example, to have records of how many cars are out on the road, and then transforming them to a second purpose, which is for social protection, and the importance of gathering consent for these secondary data uses. There's lots of examples of recent deployments of digitized administrative data, so many that I didn't include them all in the slide. Turkey's integrated social assistance system is probably one of the best examples, and we talk about it in detail in the report. But also during the COVID pandemic, a large number of countries really all over turned to using digitized administrative data for sort of categorical targeting or targeting out of beneficiaries for COVID-related social protection programs. All right, to wrap up, I wanted to give a few recommendations that we cover in the report. I think in the report we give roughly 10 recommendations, but I'm just going to highlight 5 here before I turn it over to the rest of our speakers to talk about the actually interesting part, which is the case studies. But very briefly, Domi even references at the beginning, but our first recommendation is to use digital data to complement existing infrastructure. I think, there are these gaps in digital data uses, especially around digital exclusion. So if digital data is deployed together with traditional approaches, they will both become more powerful. The second, and I think maybe the biggest advantage of digital data is the opportunity for adaptivity. And as, again, I said this about several of the data sources, but many of these are updated in basically real time. And so having this data source that gives us some kind of window into real-time economic conditions really opens up our opportunities for adaptive social protection. I think to date, we've seen these digital data sources deployed, but most of them have been used statically. And so going forward, I think, huge potential for adaptivity. In terms of thinking about the ethical considerations, I wanted to highlight consent, transparency, and contestability. So I think one thing that we've seen with the way digital data sources have been deployed in social protection so far is that they're often deployed without the knowledge of people who are registering and benefiting from the program. And going forward, I think we should be looking to transition towards deploying them in a more transparent way, where people who are registering for the program understand what data is going to be analyzed and have the opportunity to say whether or not they want to opt into that data analysis, and likewise an opportunity to contest their eligibility decision if they believe it is wrong. In this vein, just much more generally, I think it's important to think about piloting and monitoring these programs both quantitatively and qualitatively. During the COVID pandemic, we saw a lot of progress and a lot of changes in the way these programs are run and a lot more use of digital data sources. And now as we're returning to more of like a regular time social protection landscape, we have the opportunity to more carefully look at how these programs are being rolled out and more carefully make sure we're finding gaps in the programs before they're really rolled out fully. And then one final recommendation is just, I really do believe that we're going to see a lot of changes in social protection in the next 10 or so years, and a lot more use of digital data and just like big data sources in general. So now is a really good time to think about building data science and social protection capacity to be able to integrate these data sources into these systems. All right, with that, I am going to turn it back over to the rest of our speakers and back over to Tim to moderate the next part where we're going to go over the case studies. Again, just to wrap up, please, if you're interested in this, take a look at our report. There's the QR code again, and thanks for letting me share it with you.
Great. Excellent. Thank you very much, Emily. That was a great presentation of the work. And we'll be hearing more from Emily later, but for now, I would like to invite our speakers to take the stage. So I'll quickly introduce them briefly. So first of all, we'll have Alvaro Farias Velasco from Prosperia, which is a Latin American social enterprise that provides, I would say, technical solutions in the social protection space, many related to targeting, but also adjacent areas. also interesting work in explainability that hopefully we can touch on briefly. So yeah, Alvaro leads the modeling and development of their geospatial platforms, and we'll hear more about that shortly. Very interesting work. He has a master's degree from UCL in seismic engineering and catastrophe risk mitigation. So as the director of climate change and catastrophic risk. So that will be our first presentation. Then the second one will be from Lauro Bermeo, who's a social protection specialist with the World Bank, currently based in Kinshasa. And she works on social protection systems, including cash transfers and public work programs in fragile states. And we'll hear about the STEPKIN program that Laura worked on. And finally, we're going to hear from Juan Solano. So apologies, by the way, I think we have a heavy regional bias today to Latin America, so not well balanced in that way, but great speakers. So Joan is a researcher at Tillburg University, where he is at the social justice, the Global Data Justice Project at Tillburg University, a group that does really interesting work, and I encourage you to have a look at that. And he's a consultant to Fundación Carisma, a Colombian civil society that promotes human rights and the digital environment. And I think this is also where his assessment of the system emerged. I think really great speakers. I'm very excited to have them here. I'll turn it over to Alvaro, and then we'll
Okay, I couldn't hear you so well, but I believe you passed it over. So I'm just going to share my screen. Could you confirm that you're seeing it?
Yeah.
There we go. Perfect. Thanks, Tim. All right, and yeah, well, hi everybody. I'm Alvaro Farias. Thank you for the introduction, Tim, and also Emily for framing this whole discussion. As Emily mentioned, what we're going to focus on is showing you some case studies of applications of the data that she discussed to social protection policies and optimizing outreach programs for social protection systems. So I'll be talking about how we've used a lot of satellite data in different contexts in Prosperia for this goal. So let's go on. So just a little bit about Prosperia before we get into it very briefly. Prosperia was it's a social enterprise that emerged from MIT, a spin-off out of the Media Lab over there, with a lot of technical focus on how to use artificial intelligence and advanced computing in the social policy world, and a lot in social protection systems. So a lot of our clients are governments, international organizations, civil society, and our goal is mostly to have positive social impact at scale. So today we'll talk about mostly Incluya, which is one of our platforms, analysis platforms that we've been developing with a lot of our regional clients. It is now in use in about 10 Latin American countries, including Mexico, Costa Rica, which we'll talk a lot about today, the Dominican Republic, Ecuador, Argentina, Brazil, etc. So I'll get a little bit more into what exactly it does. So basically, the core application, or one of the main things that it's been used for, is for estimating the location of people in poverty in urban and rural areas. So this, we start by using satellite imagery. We use artificial intelligence, basically what Emily has introduced. At a high resolution, we aggregate the images up to 50 meters, even though usually we're using either Sentinel or Landsat, as Emily mentioned. So those are at 10 or 30 meter resolutions. Sometimes even higher. In urban areas, we do occasionally buy images and use those. So high resolution poverty maps, which we then also well, we use that to train algorithms with some other data. I'll talk a little bit more about that later. The other thing that Incluya can do is basically optimize where you might put public infrastructure. By this, I mean, if you can map out demand for schools, and you can also map out where your schools are and how long it takes for people to get to those schools. The idea is that you can identify areas, for example, where you have a population that would like to go to school, but is too far from it. So you could optimize where you put new schools, for example. And you could do that kind of analysis taking into account socioeconomic status, essentially using the poverty data that is also generated in the platform. And the idea is that we make all this data really easy to visualize, to interact with. So taking away some of the technical necessities or skills of the people making the decisions is the idea of the platform. So giving them basically the ease of use of all the data that they have and that we've aggregated up, and hopefully getting very good value out of it. So with that in mind, I'll talk about one of the use cases in more detail. This is the one in Costa Rica. So this is the platform that I was discussing. It's Incluya, and I'll show this little video of how one would interact with the platform in order to focalize outreach programs. So before we get more into the video, what I mean by focalize into outreach programs is if you're a social program, one of the main challenges you have is ensuring that the population that you're giving a benefit to is the population that is supposed to be receiving that benefit. And in Costa Rica, as well as in many places in the world, the way they do this is based on income. So they have the huge challenge of figuring out where everybody that is below a certain income is, and reaching them in order to offer them this benefit. So what we've done is use a satellite imagery to help the social programs better focalize where they should send the social workers to identify population that either is not receiving the benefit, but very likely should be receiving it, or vice versa, is receiving it and is very likely not supposed to be receiving it. But mostly we'll focus on the first case. So what we're seeing here was San Jose, Costa Rica area. That's what the zoom out was, then grid cells. Just to give you an idea, more or less 2 and a little bit grid cells are a football field. This is, football like in Latin America, with your foot. And well, the first step in this whole process is we need to be able to identify an area that is built up and is inhabited. So what we don't want to include here are things like airports and so on. Then the second step is poverty, which I'll talk a little bit later about how we estimate that. And then whether or not a certain grid cell has houses in the beneficiary database. Because what we're looking for is built up areas, so areas where people live, that are likely poor, that are not in the social registry, so that they can better focalize the social programs. So we start here including the platform, we have right now filtered cells that are the modern day are 100% probability of being habitable. What you can see is the airport is excluded. Parks are basically the grid is now only covering areas that are residential. We can then color each of these cells by the probability that the cell has poor households, with pink belonging to poor and green belonging to not poor. So here you can see in the west, there's quite a bit of pink, so highly probable areas where there's poverty. And sometimes they're intermixed, right? You have green, so not poor, mixed with pink, which is poor. And now I'll zoom in into an interesting area, we believe, which is right here, where you have this river separating clearly 2 different socioeconomic neighborhoods. The one on the north, you can see, is very organized. The streets are well planned. It's next to a golf course, so very unlikely to be poor. You can see that they're in the zoom-in, whereas in the south part of the river, you can see that, well, the roofs are a little bit different, right? The materials are what you would associate with lower cost materials. It's definitely less organized, it looks more informal. So this area is what the model has learned to predict as being very likely in poverty, whereas the other one is not. And then finally, the third step, we can now color these two areas by whether or not they are in the social registry. So here in light blue, con hogares Irube means that they are in the social registry, and pink means that they're not in the social registry. So here we can see that Costa Rica has done a great job in this neighborhood. They've sent social workers there. They've identified the entire neighborhood in the south part of the image as being poor, and they are in the social registry, whereas the north of the river side is not. So they're also a good job on their part. They've identified it correctly. Now, moving on to clusters of poverty, this is where the tool becomes useful for the final user, which is the social registry. So here we've identified 41 clusters of houses that are highly likely to be poor, that are not in the social registry. And I'll zoom in into a couple of them. So here on the platform, you can click on the eye and it will take you to that location. So here you can see there's an area that looks similar to the one that we saw earlier. It looks like it's a high probability of being poor. It's not in the social registry. This we know because we do have that data, and it is geocoded in the case of Costa Rica. Another cluster in the airport that I think is quite interesting, so I'll pause the video. Here to the right, you have a cluster of poverty that the analysis has shown is not in the social registry and is highly likely to be in. And on the left side, you have a very similar settlement that is in the social registry. So this could be a timing issue, let's say, where the social workers did attend, they were aware that there were informal settlements or people in poverty in this area behind the airport, and they went there and they cut these people and put them in order to receive the benefits. But maybe later on in time, this other settlement on the right side of the image developed. It's not in the social registry. So this tool can help the final user focalize those outreach programs to identify areas where they could be going. I just want to be clear that it's not used as the mechanism by which a household is eligible to receive a benefit. Because of course there's limitations here. You're only seeing the top of the house. There could be houses that from the top look like there's a high probability that they are in poverty, but inside it's a different picture, and that's not the case. And that's why it's important that this is a complementary tool that social workers use, not the final answer. But still, we've received very good feedback from our users, and we're quite happy with that. I'll move on to another example now, which is in Mexico City, and this is more to do with geospatial optimization of services, taking into account poverty. So here we have a similar map. This is Mexico City. We have selected on top areas that are highly likely to be habitable or occupied, and then the probability of them being poor. So pink belonging to poor areas.
Just briefly, where sadly this is super interesting. I think it'd be great to have a longer session, but yeah, if you could just keep it brief.
I'll move super quick, 2 minutes then, but thanks. Here what we're seeing are the dots are areas where the government is supplying these centers that are called Centros Pilar, which are areas where they provide services to communities. And the point is that they're only placed in areas of poverty. So here, the blue dots are these centers along Mexico City. The pink areas around them are areas that you can travel to one of these centers within 30 minutes using either walking or public transport or a car. So areas that are not in pink are areas that are not within, let's say, 30 minutes of one of these centers. And then basically we can identify the areas that are not within 30 minutes and that are also poor. And that way we could optimize where you might want to build some of these new centers. So for example, this red dot here is in an area where there is poor households, and they're currently now within 30 minutes of one of these pillar centers. So this is a way to optimize the infrastructure that is supposed to reach poor population. Is basically the main goal. And in the interest of time, I won't talk much more about this. I'll just move on to the last part, which has to do a little bit about disasters. Just wanted to mention, it's something Emily also talked about, how satellite imagery or alternative sort of data sources could be used to map disaster impacts. And here what we're seeing is for Dominican Republic, the dots in this case in the map are the houses in the social registry. So they're socially vulnerable houses. And the shape we're seeing over the ocean and over part of the Dominican Republic are modeled wind speeds from Hurricane Fiona, which we have modeled using physical models based on central pressure values from the National Hurricane Center in the US. And what we can use this data for is we put in those central pressure values, we estimate wind speeds as a function of those, as a function of distance as well, and a couple of other storm variables. So we get the wind speed at each location where there's a household in SUVM, the social registry. Then in the social registry, we know the construction material, so we can estimate the physical vulnerability of the house. And we can therefore estimate the probability that the house is damaged by an event before it occurs using the forecast or after it occurs using the actual central pressure readings. So this is just an example of how this geospatial data is being used in the intersection of social policy programs, social programs, and natural disasters. And thank you all for your time. I'm done with that, Tim. Thank you.
Fantastic. Thank you so much, Alvaro. Yeah, I'd love to hear more. You are clearly making very fast progress. So I just to note, I sometimes talk to the good people from Prosperia, and every time I talk to them, I'm amazed at the progress they're making and the tools they're developing. So very, very interesting. So yeah, thanks for that. And yeah, let's move on to Laura Bermeo.
Thanks, Tim. Let me move on to share my screen. Can you see my screen now? And can you hear me well?
Yes.
Okay, great. So good morning and good afternoon to everyone. Thank you very much for having me with you today. I will be presenting today the experience of setting up from scratch a digital cash transfer program in Kinshasa in response to the COVID-19 crisis. Very quickly, I'm gonna start by presenting some elements of context and then explain how we leverage digital tools to do the identification, registration, and payment of beneficiaries remotely and at scale. I will move on then to present some of the results to date and acknowledge some of the challenges and risks of this model that we developed in Kinshasa, and finalize with presenting what are the next steps and lessons that we draw from this experience. So in terms of context, Kinshasa is a mega city of about 15 million inhabitants, with estimations of about 69% poverty rate pre-COVID. When the COVID-19 crisis started unfolding worldwide, Kinshasa quickly became the epicenter of the crisis in the country. The government put in place mobility restrictions that were followed by the closure of businesses, services, and job losses, and essentially increasing the financial vulnerability of the most vulnerable households in the city. Broadly, DRC is a data desert. Just to give an example, but the last census is over 35 years old. There is no social registry, no database on vulnerable households that could be leveraged to inform the design or the targeting of safety net system. In particular, for Kinshasa, there was not available any poverty maps, or there was no pre-existing programs. Typically, safety nets or humanitarian programs were focused on rural areas. So there was no existing list of beneficiaries or delivery systems that could be leveraged to be scaled up in response for COVID. However, in terms of opportunities, we had estimates of about 90% telephone penetration in the city. So in summary, the DRC government was facing this big challenge, this big crisis, and the need to provide a safety net for the urban population under a very complex scenario. They need to build a program from scratch, remotely and quickly. And I think this also helped boost the reflection about considering unconventional approaches to overcome these limitations. So I'm going to move on now to present what was the solution proposed for Kinshasa. The first step is the identification of eligible population, which I think is the most interesting part regarding the discussion today. And the first challenge was essentially, identifying the eligible population with the additional constraint that under the COVID-19 scenario, we needed to do this remotely in order to minimize the contagion risks. So the first step that we did was essentially to do geographical targeting and identify which will be the poorest neighborhoods that will benefit from the program. The approach we did here was essentially to use all the data that was already available, because starting a data collection exercise will likely imply significant time and resources that were of the essence. In the case of Kinshasa, we had available satellite imagery and other geospatial data that was recently used by the urban team of the World Bank. And we used this to develop a hotspot and vulnerability map, essentially using certain indicators as proxies for poverty and vulnerability. For instance, overcrowding, precarious constructions, density of buildings, or areas prone to flooding. And the principle here is that by focusing on the poorest areas, we are aiming to minimize the inclusion errors. That is, we expect that there are few rich people living in the poorest neighborhoods of Kinshasa. So once we identified the geographical areas of interest, the next step was to identify people living in these areas. And here we had an innovative partnership. We worked in partnership with telecom operators. As you may know, telecom operators have a large amount of data on their clients. And in particular, they are able to triangulate the location of their antennas and the coverage areas and identify with a high degree of precision the location of the clients. So in Kinshasa, we approached all the telecom operators in the country, the 4 of them. We signed non-disclosure agreements, and essentially we worked with them in obtaining an anonymized list of cell phone subscribers that were mapped to the neighborhoods of interest. Here I want to highlight that for privacy and data protection considerations, we asked only to obtain cell phone numbers without any other personal identification documentation attached to them. And the last step that we did was to try to further filter for inclusion errors. So essentially use the information that telecom operators have on consumption and usage patterns, what is known as cold data records, and try to identify people whose behavior could signal that they are better off and should not benefit from social assistance. So for instance, people with large monthly consumptions, people with monthly subscriptions, or with international phone calls. So once we had this wide list of potentially eligible people, the next challenge was actually to do the self-registration of beneficiaries. So in the last step, we had a list of anonymized phone numbers, but that the next challenge was actually to collect the consent and basic data from these phone numbers to turn this list into an actual program beneficiary registry. So the first step was to set up a system that would work fast and at scale. And for this, we require that people can register themselves simultaneously, having some sort of crowdsourcing approach, using tools such as bidirectional SMS, USSD platforms, or even call centers. These efforts need to be accompanied by a strong communication campaign to try to be as inclusive as possible. So mixing traditional mass communication methods with technologies such as SMS broadcast, IVR, basically recorded messages, or their traditional approaches such as the deployment of information centers or program ambassadors. And as a last step, what we did was also to validate the beneficiary registry, do basic checks for duplicates, data consistency, and essentially ensure that the people that registered to the program were corresponding to the whitelist that we received from the telecom operators. And as a third challenge, it was essentially doing the digital payments, but I guess this is quite straightforward as most mobile money programs. The first step is essentially opening the mobile money accounts for beneficiaries. Here, the Know Your Customer regulations can pose a bottleneck, especially for vulnerable population who may not have identification documents to comply with these requirements. So what we did in DRC was to leverage a budget support operation from the World Bank to essentially work with the central bank of the DRC to adopt an instruction to simplify the KYC regulation. So this would allow us to open special accounts for beneficiaries of social or humanitarian assistance under the COVID-19 crisis. These special accounts will have limits on the amount that could be transacted per day or per month, but essentially would allow to open these accounts as long as the list of beneficiaries is endorsed by the respective program implementing the program. As a next step, the operators will be instructed to initiate the social transfers. And as a final step, it's important, of course, to make sure that there is a follow-up of beneficiaries and accompaniment. So we also put in place a hotline to provide information and address grievances or complaints, and also put in place surveys to monitor the implementation and the beneficiaries' experience. So very quickly, some of the results to date. This program was launched in March of 2021, and very quickly, within 3 months of launch, it reached 100,000 beneficiaries. In terms of scale, the program has reached more than 270,000 direct recipients, which in turn support their households. So we have estimates of about 1.3 million indirect beneficiaries in 114 neighborhoods of Kinshasa. In terms of impact, we have disbursed about $41 million in social transfers. This goes essentially directly to the beneficiaries' pockets. We have estimates of about 94% of efficiency. That is, for every dollar invested in the program, 94 cents go directly to the beneficiaries and 6 cents go to cover the program management, the cost of financial service providers, and also banking fees. Here I have to make a caveat that this program was extremely efficient, also because it leveraged from corporate responsibility from the private sector, which waived many of the fees. In terms of outcomes, we have done some analysis that allow us to prove that the targeting works and that essentially recipients are indeed poor and vulnerable, that the cash is spent in food. We have estimates about 50% of beneficiaries covering essential basic needs, and about 1/3 of them investing in health and education. We also expect to see some positive externalities in terms of financial inclusion, private sector development, and economic multipliers in the local economies. And essentially, this database of poor and vulnerable population in Kinshasa can be also used to build the social registry in the country. And finally, this program has benefited from strong partnerships with the private sector and research and development with Give Directly and Ideas 42 for behavioral science. Now, moving to the analysis of risk and limitations of this approach, we have essentially identified three main buckets. The first one is in terms of targeting. The approach and the model we developed for Kinshasa would essentially work for a quasi-universal targeting, where almost everyone in a geographical area is eligible to participate in the program. And this approach is suitable for areas where we have a homogeneous population, almost everyone has the same levels of poverty, or also where there are covariate shocks. We consider this is also suitable for reaching the missing middle, essentially people with some source of income, but no coverage of safety nets and at risk of falling into poverty in case of a crisis. But we consider this approach is not recommended for programs where there is need to have a high level of accuracy in the targeting and where we aim to reach a very specific population group. For instance, the ultra poor. If you don't have a cell phone, you are by design excluded from the program. Or for instance, we have estimates that in the first phase of the program, only about 36% of the beneficiaries were female. As a second consideration, we have the introduction of new technologies, especially in vulnerable groups, which typically have less digital literacy and can be more at risk. Analysis from our grievance redress mechanism essentially showed us main recurrent issues, beneficiaries forgetting frequently their PIN, but also people benefiting or abusing of beneficiaries to steal their PIN and make some fraud. So for this, it's important to accompany the program with tailored communication strategies and sensitization on mobile money services. And as a third consideration, we consider the policy framework that may be necessary to put in place in order to have a program like this succeed. For instance, in case with the KYC regulation that we worked in the DRC. And in the case of Kinshasa, having a strong government buy-in and a strong partnership with the private sector was actually a key enabling and success factor. Let me conclude quickly to present the next steps of the program. We are currently working on a scale-up. We have secured additional $50 million to reach 500,000 beneficiaries over 2023. For this next phase, we will focus on strengthening the delivery system, especially the self-registration part of the delivery chain. We are also working on expanding to all the telecom operators in order to foster the competition, but also to maximize the inclusiveness of the program, make sure that no one is excluded because of using one operator or the other. And finally, we are working on developing the urban safety nets agenda and seeing how this approach could be replicated in other urban areas of the country. For instance, in Eastern DRC, which is currently affected by crisis and under heavy humanitarian considerations. Let me stop here and we continue in the Q&A. Thank you.
Brilliant. Thank you very much, Laura. That was very interesting and really goes to show how you exploited the potential of those digital data sources to overcome the limitations of the environment where basically none of the traditional tools for targeting and social protection systems were available. And, those constructing them on the fly is a real achievement. So yeah, congratulations. Very interesting program. So yeah, finally, I'd like to invite Juan Lopez Solano to talk about the experience of Colombia. And Juan, sorry, I should have said this earlier. If we can keep to 10 minutes, that'd be great, so that we can also hear from the audience and go through some questions. Thank you.
Hi, can you see my screen?
No,
yep.
Not right.
Hi. No.
I
Um, oh, I don't know what's going on.
We can ask, I think.
Yeah, maybe it's better. I don't know what's going on.
Fernanda, do you have the slides ready for sharing? Then Juan, you will just have to say next slide, please, when you're ready for
Sure.
the.
Oh, thank you, Fernanda. Okay, my name is Joan Lopez. I'm a researcher at the Global Data Justice Project at Tillburg University. But also, I used to work at Fundación Carisma, that is a civil society organization that works in the intersection between human rights and technology in Colombia. So we decided to analyze the use of a social registry in Colombia using the perspective of human rights. That's something that is not so common in terms of the use of digital technologies in social protection. Generally, we are concerned about efficiency, but not about the experiences, accountability, and human rights of the communities. And next, please. So first of all, it's important to understand what is SISBEN. So SISBEN is the system for potential beneficiaries of social programs in Colombia. Is basically the entrance for social rights in the country. So everyone needs to have a CISBEN classification to access to the main social protection programs in terms of healthcare, education, almost all the social offer of the Colombian state. So it's a social right in itself, being able of accessing CISBEN. So SISBEN it has two parts mainly: a social classification algorithm, a series of rules that determines who is in poverty, and a personal data system. So basically, it's a system with almost 80% of the population with data that is collected through massive surveys that includes things about family composition, expenses, healthcare. So yeah, we have like a visual perspective of how it works. So being non-poor and the C being non-poor and the A being in extreme poverty. Next slide, please. So CISBEN has serious problems in terms of human rights, especially in terms of accessing the registry. A lot of people have real problems accessing the registry. The registry is controlled by local government, so it has a lot of political manipulation and difficulties to access that. But in 2016, the government decided to modernize CISBEN, and they introduce different technologies in different parts, but we are especially concerned with these two changes that we have here. But they were not interested in the access. They were rather interested in creating a new classification. This new classification it's based on prediction. So basically tries to predict the income generating capacity of each household using different databases to place people in socioeconomic groups. And the second one is that the government will verify the information that people is reporting with other 36 public and private database. So every inconsistency between the information that people is providing through the survey would generate a mark that could generating exclusion from social services. So the government could basically with this regulation verify the information with any database that they consider necessary. Next slide, please. Next slide, please. Thanks. So they have a lot of agreements, but I will focus today in two agreements that they have with financial brokers. So they use this regulation to create an agreement with Experian and TransUnion, to multinationals based on that had business on risk profiling and credit analysis. So they decided to create this agreement, and it's really interesting how this is basically changing how the public system works. So they decided to offer the database to experience basically the access to information about low income communities for financial profiling in exchange to cross-check the data collected with the information that they have available over each person. And also they receive an algorithm for predicting income that is owned by Experian to be used in Sysben. So we have serious issues here over the change of purpose of the data. The purpose that once was for social protection now is a commodity that could be exchanged in the market. We have an effort of undermining the public capacity and the publicness in terms of control. Next slide, please. So I will just show you really fast some of the information that Experian offered to the National Planning Department, the institution in charge of Sysben. So some information about the identification of the client, the loans, the types of loans and the installments, the credit cards, and the telecommunication sector information. I would not, I won't go into detail of this, but next slide, please. If you are interested, I will show the report that we did to check it out. And the National Planning Department connected these 36 databases. I will just show some categories of these information that they access. So national ID databases, healthcare databases, so we're accessing to healthcare, some procedures that are happening inside the healthcare system, the contributions to the healthcare system, education, pensions, information on conditional cash transfers, driver's license, really problematic information like registry of victims of the conflict in Colombia, indigenous census list. So these are some categories of the information that they have access now. So next slide, please. Next slide, please. Thanks. So I would just show the serious problems that are happening, that were happening before, because the system is from the 90s. So there are serious regulatory arbitrariness that happens inside this system. So this is the decree that regulates Sysben, and it states that the public entities and private performing public functions shall make available to a national planning department the information that they generate, obtain, acquire, control, or manage. So basically, this allows the government to access almost every database that they consider necessary, even though it could not be proportional to the need that they are interested on. Next slide, please. We also have these cases of these are the grounds or the reasons to exclude someone from social programs. So you have here different cases, but I want to point out the level of regulatory arbitrariness that we have here. So unjustified change in information as determined by the National Planning Department, records of income about the amounts determined by the National Planning Department, or any inconsistencies as deemed by the National Planning Department. So we are showing here the level of arbitrariness that we have in these kind of systems. Next slide, please. I don't know what happened with this slide, but the idea is that also the rules, the algorithm that determine who is poor and who's not is completely secret. The main reason for that is that they claim that if everyone knows how people is classified, the people will try to use that to access to social resources, and that could affect the macroeconomic situation of the country. So basically, we have here a really arbitrariness machine in which the system is completely secret, and basically people just provide information to a local authority. A local authority sends that information to a national planning department, and then it receives the classification. So basically, people don't know what's going on, and they have been changing the regulations to concentrate the capabilities and all the functions of Sysben in the National Planning Department rather than in a series of institutions. Next slide, please. And also to show this kind of problem, we when people start to in 2022, 21, they start to receive the new classification. people start to complain and to ask for explanations about what was going on. And this was the official response of the government. We clarified that the classification is the result of the analysis of the information declared under oath in the survey by the household, but when the person presents a disagreement, it should be about information recorded and not about the classification. But we should consider that people don't know exactly what are the databases that the National Planning Department is connecting to. And also they don't know how their data is used, and even they don't know what data they provided, because they don't receive a copy of the information that they provided to the National Planning Department. Next slide, please. So we have serious cases here over discrimination, surveillance, and punishment. Disproportionate data agreements in which there are no consideration about what is necessary, what data is necessary and proportionate to have. We have a case of acceptability of experimentation over this system, and the responsibility of the failures in case of a disagreement between the databases that the National Planning Department is using and the information provided by the people. The ones that need to solve the problem is the people, and the ones that are super vulnerable, victims of violence, they need to solve a problem going to the national authorities. We have serious concerns over suspicion and stigmatization. They presuppose that people in poverty is possible suspects of being liars. We have limitations to due process and transparency, so people cannot easily contestate these systems because they don't have access to information and they don't have any capability to do it. And next slide, please. So, and the other problem is also over the participation. Next slide, please. So people don't being in poverty condition is not just a lack of financial means, but also a lack of capacity to decide over your own life. And that's something that is not being taken into account in these systems. So the government is reproducing this violence. So yeah, basically the conclusions is that the Colombian government decided a system that is that has been concentrating the power in the government over the whole social protection system. That this new system reproduce the historical marginalization of communities, making them subject of experimentation, punish them, blaming them for each failure in the system, and making them suspects of fraud. And communities don't have access to the information that they need to, access to the right to correct, complement, and update the data within SysBen. Next slide, please. And this is my last conclusion. There is no proportionality test in the interconnection of administrative databases based on human rights, privacy, autonomy for marginalized communities. So basically, not the possibility that of connecting databases could not mean that you could connect and verify everything, because there is a need for social rights and dignity to be fulfilled in these systems. And this is something that is not being considered in the development and introduction of digital technologies that maybe could make worse vulnerabilities that are present in those systems. So I think I will leave that for now. I think maybe you can go to a last slide and just show the possible my research. Our research is in these two reports, and you can consult all the information if you are interested in more information about it. Thank you.
Brilliant. Thank you very much, Juan. Yeah, I think this is really interesting and important work, and goes to show that purely technical solutions and just the availability of data doesn't mean that one should use the data, and that very much there's a lot of things to be taken into account that should be considered before actually going out. And yeah, that you know, technological solutions may not be suitable in what is a social and political system. And so, yeah, a lot of things being considered. And so the role of civil society organizations and researchers that follow this field critically, and Fundación Charisma is a great example of that. And the work of the group in Tillburg in general, I highly recommend to anybody interested in applying these technologies and following up on that and seeing also how things can go wrong and what one may wish to consider as a practitioner to avoid that kind of scenario. So yeah, thank you very much, everyone, for your presentations. That was very interesting. I have done a terrible job of keeping time. Apologies for that. So I think what we will do now to make sure that the audience gets an opportunity to ask their questions, we will cover audience questions first. And so I will go through them and I may answer some myself. I may allocate some, and then we will go to the other list of questions for the remaining time. So Maria Aleksinska, if I say that correctly, was first out and asked them, so what do you mean exactly by social protection? It includes other aspects such as health protection, unemployment benefit, maternity pensions. So social protection is a very broad field, and a lot of the targeting we have discussed here refers to targeting on socio-economic, on sort of welfare, economic welfare, which is typically measured by consumption. So that there's a certain consumption level, and the targeting on mobile phone data, for example, tries to achieve it. Satellite imagery can do the same thing, that for a given area, the average or household or SIM card consumption level estimated is low. This does not work for assessment of other categorical programs such as the social programs you mentioned. So this is very much economic welfare targeting that we're talking about in this regard. Then I'll pass the second question on to Laura, perhaps. How do you deal with mistargeting and with cases of multiple phone subscriptions? So, what if there's a SIM card in that area? How do you make sure that this is an eligible person?
Thank you, Tim. I think that's a very good question, and it's basically one of the biggest challenges we experience in the program. The approach we had in Kinshasa was essentially to try to assign one geographical area to only one operator. So we have indicators that people will have multiple SIM cards, but essentially from different operators. So by covering one area with just one operator, we would try to reduce this risk. That being said, there are still cases of potentially having people in the same household with multiple telephones or SIM cards. We would expect that by trying to target the poorest neighborhoods, we will limit that risk of having essentially many cell phones in the same households. But yeah, I have to say this is part of the limitations of this program. We are not able to do a very detailed targeting, and we essentially have to acknowledge the limitations and try to balance with the considerations in terms of speed, scale, and efficiency and cost efficiency.
Mm-hmm. Thanks, Laura. Yeah, Emily, I don't know if you want to add anything on that from the Novici perspective, and also perhaps cover the issue of gender here. So I believe Novici had a gender component in the benefit amount. If you want to say something about that, and the general question of how gender balance and can be and fair receipt of benefits can be safeguarded in a situation where it's often men that have access to accounts, financial accounts.
Yeah, I'd be happy to speak to both the sort of sub-questions here. And for context, I worked on Togo's Novici program, which, as Tim mentioned, which also did something pretty similar to the program Laura described in terms of using economic status inferred from phone data to determine eligibility for the program. Regarding the question about mistargeting in cases of multiple phone subscriptions, I think one potential way to deal with this is, in addition to the way Laura described it, so maybe an alternative is to link the program to some kind of national ID. And so if one SIM card is only able to register, for example, one national ID and therefore one person, there's less scope for fraud or manipulation when people are registering multiple times for the program. At the same time, there's implications for digital exclusion if people don't have access to a SIM card and aren't able to register, for example, on a neighbor's SIM card. Regarding the question about gender, I think this is a very important question. In particular, when we look at sort of rates of mobile phone penetration, in Togo, certainly where I'm very familiar with it, but I think broadly across low-income countries, we generally see that women own phones at a lower rate than men. And so even, for example, if women are able to register for a program on their husband's phone, in that case, the money is likely to be controlled by a male member of the household. One way that Novisi, at least in Togo, tried to deal with this was actually providing larger transfers to women than to men to incentivize women to register for the program. I would say this worked to some extent, but it's still imperfect in that women just have lower access to phones. And so I think basically this is a concern for digital exclusion, and for me highlights the importance of having sort of different paths into the social safety net, especially paths that women are able to access.
Thanks. Yeah. Okay, so the next question, I believe this refers to Alvaro's presentation. So how easy and difficult was it to integrate that with government structures, these kinds of programs, and can those solutions easily be handed over to the authorities? Considering the sustainability of digital solutions. Maybe you want to take that.
Yeah, I mean, I think that depends on the project itself and how willing they are to actually engage with the results. In some cases, well, just generally as a philosophy, the data that we produce is in open formats. So, as GeoJSON files or rasters, you can open it in free software like QGIS, etc. It does not have to be open in our own platforms. And that does enable the data to be integrated into other systems that the government might have, right? If they want to do a join with a different data set with the data that we have, they're able to do that. But generally what we have found is that they prefer to use the platforms that we're producing for their decision making, and generally, we make those very accessible. But we do have a cost. We incur costs for hosting that data and for having the platform. So we do need to pass that on. That's sort of an ongoing topic that we need to strike a balance between not expecting our users to be highly technically competent, but also not making our solution prohibitively expensive for them. So yeah.
Thanks. Yeah, I mean, maybe I can weigh in with a question myself then. I mean, social protection systems are very much a core function of the state, if you will, right? So control over those systems is, giving up control over the system to a private entity could be seen as problematic in many ways, right? So if something goes wrong, who is responsible? Who do you hold to account? And apart from the cost implications, which are of course another interesting question. So, Alvaro, do you have a view on that? I mean, do you feel that you provide an alternative to state solution? Is this a privatization of social protection systems? How do you are there any concerns on the client side in this regard, or how are your interactions from that perspective?
Yeah, so I mean, so far we haven't ran into a client that is strongly concerned about that, but it is something that we've thought about for sure. We don't mean to replace what social programs are doing, and we do not want to take any political stance on what they should be doing. What we're trying to do is just help them do whatever they decide that they want to do for their political reasons. That is up to democratic processes in the country. We just want to help them do that in the most optimum way possible. So in terms of us running the data or taking over their jobs, that is not the goal. It's just we want to give them access to the technical solutions that might help them optimize the processes. So one thing that we're thinking of doing, well, and we do offer this, is when we are hired for a project, we do train people within the social protection system to use our platform. And there are different levels of users. So they can basically engage with the platform at a more technical level if they want to, or a less technical level if they want to. And the idea is more to empower them to make the decisions they want. We're not taking over that role. We don't see ourselves filling that role.
Okay, thanks. And yeah, I mean, maybe you can bring in Juan on that question as well. I mean, Juan, also related to your criticism of the use of private sector data in these systems. I mean, for instance, it raises the question of how you can control the quality of the data, how you can make sure that the data is accurate, how people can correct that kind of data. Do you see a place for private data sources in social protection systems in general? And if so, under what conditions? And similarly, so do you see a place for privately provided aspects of these systems, or do you think that should be handled by the government itself?
Yes, I completely agree with you that that's a real problem in terms of the, you cannot help to control some things that are in the databases, in private databases. Obviously, there is the data protection law and these kind of things, but it's not the same as the accountability that the state should have, should be accountable for you. And also there is an issue, a real issue, and it's that a lot of governments they think that having free and open information is the same as having public information. So if for example, if they access to a data or a service for free, they think that this is like public information, but rather publicness means the capability of public actors to control that data. So for example, it's important to understand to analyze also the sustainability of partnerships, for example. So they have partnerships for free with governments, some private companies, and they even offer services, but then who is able to manage that data? And even when a private decides, for example, to cut that service, or to raise the prices, who is able to control that? So I think we are rather interested in having publicness, public control and accountability in the partnerships with private data and private providers. Because even if the data or the machine appears to be for free, what it means in terms of a government stepping up of that agreement, stepping out. Sorry.
Yeah, thanks. I think to me that relates also to a point that is that Laura alluded to in the provision of in the use of private companies for the provision of these systems. I mean, for mobile networks in most countries, that tends to be an oligopoly, right? A small number of companies that have very intense commercial rivalry, and I suppose the objective of a universal social protection system is to be able to reach the whole population, i.e., customers of any of those companies. Laura, do you want to say something about how the aspect of competition and cooperation and how that complicates the role of the state in providing universal accessibility?
Thank you, Tim. Yeah, I think these are very important considerations when you are thinking of designing a program and also how this program can later on become part of the national systems that can be sustainable. In particular, in the DRC, you have indeed payment service providers and mobile money operators, which can come into essentially provide this last step in the delivery chain and provide solutions for governments. And of course, they have a comparative advantage and they have a unique role. So I don't think, or at least there is this question whether governments should try to replicate these capabilities. I don't think it's an option for the DRC, but I think rather what we tried to do very carefully was also try to think on in the design of the program, how to design the incentives and how to decide especially when we set up the procurement phase with the different actors, how to set up those conditions and those contracts that will essentially try to protect clients, try to protect the interest from the financial service providers, ensure that we're not creating monopolies or creating systems that are locked to one unique provider. Of course, this is a learn by doing, and I think I will say that we just try to bring this consideration when we were designing the project, and especially when we were doing the part of the procurement and the selection of the financial service providers in the first experience. And now for the next phase, we're really trying to think more on how we can work interoperably with all the operators and make sure that we are not excluding people by design.
Thanks. Yeah. I guess, I mean, just to note, a similar issue perhaps arises with satellite providers, which are also, once you know, there are very few companies, I think 2 major ones in the field. And yeah, like the reliance on private sector infrastructure and all this novel data is an issue. And I think one of the interesting things to keep an eye on in future. So I'll ask to the last question, the Q&A currently. I'll address this one to Emily. So Konrad Nunmacher is asking, why are there so few impact evaluations here in the report and the examples in the presentation today, as it's also an area where novel data could be very applicable. Do you have an answer to that, Emily?
Yeah, thank you for asking this question, Konrad. It's a really good question. I suppose to try to directly answer, like, why don't we see a lot of uses of novel data in impact evaluation to date? I guess in my best theory is just that, you know, these uses of novel data, as you can see from, you know, what we've talked about today, are all very recent. We're talking about last 2 to 3 years, and many of them were developed in the context of the COVID pandemic, when sort of the imperative goal was to, you know, find a way to run these social protection systems mostly remotely, as Laura was describing. And sort of, you know, one of the key imperatives to that was targeting. And so a lot of what we've talked about today is targeting, as well as sort of, you know, registration, outreach is like really essential aspects of the delivery chain. That's not to say that impact evaluation is not essential, it's not important, but I think it hasn't been as much of a focus to date, just because we've been focused on rolling these programs out. That being said, I think I agree with you that there's a lot of potential for impact evaluation using novel data sources, and especially sort of, as I was hinting at, like this high frequency sort of real-time insight into well-being. And there is some interesting work happening in the research literature that is introducing this paradigm, especially around satellite imagery. So there's 2 recent papers, and I can put them in the chat if you're interested, that look at using satellite imagery to evaluate the impacts of large aid programs. I believe one was done working with Give Directly in Uganda, and the other one looks at evaluating the impact of electrification in Rwanda using satellite imagery. So basically, you know, people are starting to show that this is possible, and I imagine that it will be integrated into real world programs in the coming years, but for whatever reason, it just hasn't been a priority yet.
Can I come in to compliment? Yeah, just to share also from the experience in DRC, I think we were in a unique position of basically aligning the incentives from the government and the private sector that actually was enabled for getting access to CDR data. But I have to say here, it was because there was a very strong government interest, and also the alignment from the private sector for the financial and expanding their sector, their market, right? But I have to say also we had the experience of trying to access this CDR data for research purposes, and there we or another bank teams were not able to get access to the data, right? So you have also basically the alignment of how to get access to this data, and it's different in each case. I have to say, in the DRC, they were not able to get access to CDR data, and I guess this applies to other sources of innovative data sources.
Yeah, thanks. That relates to another question on the KYC and lack of data in the DRC. How was that handled? I think you work with the central bank on facilitating account setups on the basis of much more limited information than usual, right? And more broadly, this relates to a key question, especially around mobile phones, but perhaps all other digital digital finance, certainly web and social media data. To what extent can digital exclusion be mitigated? And to what extent are we excluding people that are the most vulnerable, or at least the most economically disadvantaged people, and what can be done to mitigate that situation? So maybe I'll put that out to the panel if there are any thoughts on this question. How about mitigation and lack of documentation and lack of access? Okay.
Well, I'm happy to start by pointing out a couple, I think, examples from our panelists that highlight this. And I think, to me, this points towards the importance of, and this is one of our recommendations in the report, like pairing, digital outreach and digital targeting and so on with strong existing social protection systems and strong ground games. And so I think something that is that Laura didn't highlight too much, but mentioned briefly, was like the use of program ambassadors who are like on the ground. I'm not sure if local celebrities would be the right word, but people who could spread the word about the program. And then on the Prosperia side, we see the use of digital data not to like directly determine targeting, but to target these outreach campaigns where then we have people on the ground going to spread the word about the program. And so I think, thinking about how best we can leverage digital data in concert with on the ground campaigns and existing social protection infrastructure, while maybe not the solution or the answer to your question, is at least a start.
Yeah, I would like to add something, and it's also that I completely agree with the need, and it's related with the human rights aspect that I was mentioning of the participation and the empowerment of people in condition or marginalized communities in the development of those systems is fundamental to avoid these kind of exclusion situations. So people that are part of the community and the community organizations could not be a second actor that is consult, I don't know, like through a consultancy or through a survey in internet or these kind of things, but rather this development of these social programs really needs to take into account the communities and their perspectives, and they are experts in their in the experience of poverty, and this is something that is not being considered. I would say at least in the Colombian case, the technicians in the social protection realm, they prefer to be seated in a desk in Bogota rather than talking with the actors and the people that is really suffering from those from the systematic violence of poverty.
If I can come in to complement, I can share based on the DRC experiences. We're basically working on two tracks. We have the traditional programs where we do a lot of work on trying to essentially reach and work with the communities at a more close approach and basically accompany in the program. And we also have the experience of Kinshasa, which is quite exceptional and basically fast track, where we acknowledge that there are limitations, but also these efficiency considerations. But I think broadly the message is that I think also social protection programs can be used as a platform for digitalization. So essentially use the programs to essentially pass messages, sensitize communities, and accompany the broader dynamics of the popularization of these tools and technologies. I think, for instance, of WhatsApp, which over the past years have become really widely used, and I think now it's is even used in rural areas and in the lower groups of in the lower social groups. So I think there is this broader dynamics where we can see how social protection can also help the most poor and vulnerable to get access to this program. I'm also thinking of the use of USSD platforms or SMS messages. I think they're really they can be very difficult to use for the most poor and vulnerable groups. In the first, can be a bit shocking, but once they get exposed to them, several iterations, there are these dynamics where people can reach out to their neighbor or can reach out to the younger groups and essentially be part of this process where they get more accustomed to use these tools and essentially learn to use them.
Okay, yeah, thanks. Okay, so moving on to a different point is that we have novel data here as the key new input, but one of the questions is what data do you use to calibrate this? So the sort of ground truth, the thing we're often trying to predict or estimate with the novel data doesn't come from the data itself, right? So in what way are these systems a substitute to existing systems and existing data sources? In what way are they a complement? In what way are they parallel? Perhaps if each of you wanted to say what is this a complement? Is it a replacement? How do you see your application? Maybe starting with Alvaro this time.
Sure. I mean, I would say that the tool that you saw here in Cluj is more of a complement to existing tools and campaigns. I think the main point of it is to better allocate your outreach efforts to areas where you're going to find the low-hanging fruits. And by that, I mean that, you send out an outreach campaign, you have limited people and resources, they cannot travel everywhere. So what we're providing is a list of clusters of poverty where if you were to go there, you're very likely to find people that should be in the social program that are not currently there. And we also identify vice versa, right? So areas where it's likely that you have some population that might not be actually eligible to be in the social program. So this is just a way to optimize those efforts, basically.
Yeah, and I think in your case, to answer the audience question, I think the answer is that you very much leverage the existing social registry in order to train this satellite model, right? That very much relies on the existence of already a good existing social registry. In the absence of that, for example, this is my comment now, as common data on living standard is often very sparse. And it would be very difficult to train a high-resolution satellite model on that to make this kind of fine-grained prediction. Do you think that's true or not?
I mean, I think what ends up happening is you lose accuracy. At the worst case, if let's say you have no geocoded data on income or beneficiaries of a social program, you have nothing. At the worst case, what you would end up doing is just looking at a satellite image of a neighborhood or certain houses, and you would be making the determination if you think these are poor households or not. So you would just tag those and then you would train an algorithm based on that and it would make predictions based on that. Of course, there would be a lot of bias there. It would definitely be less accurate than having the other data, but it could still show some trends of where poor households are. So there's, I think it's a spectrum of accuracy and use cases.
Yeah, thanks. Emily, do you want to go next? What kind of ground truth data is there? Is it and is the novel data a substitute, a complement?
Yeah, I mean, I think it's a great question. I can talk about a little bit how I've seen it deployed so far and how I think maybe it would best be deployed in the future and separate those a little bit. I think so far it's like, especially during the COVID pandemic, we saw it deployed largely as a substitute, I think, for traditional data, in particular because many countries were basically in a situation where they wanted to give out cash transfers or another form of social protection benefit and didn't have any information to use for things like targeting. And so in most of those programs, it was used as a substitute. Going forward, I think there's a lot of reasons to believe that it would better be used as a complement. And it sounds like, I mean, Laura, you can correct me if I'm wrong, but it sounds like this is sort of exactly what's happening in the DRC, which is looking at having these like a sort of traditional social protection program complementary with a sort of digital first approach. And again, I think I said this already, but given all the limitations we've talked about to digital data in terms of digital exclusion, but also in terms of things like transparency, a complement seems like the way to go. Maybe Laura, you can chime in since I just referenced your work.
No, Emily, I fully agree. I think best case scenario, we will see how both approaches can complement. Of course, I'm sure in the experience of a bit of a extreme case scenario, DRC, where basically data is very scarce. I have to say you can also go the other way around. For instance, for the satellite imagery and the geographical targeting we did in the program, we did first a layer of geographical targeting, but then we also went back to the field to do a data validation and essentially a bit of a post accuracy check. But yeah, I think essentially these are investments that need to be done, and we work on setting the basis for systems. But in some countries, this can go faster or at different speeds. We do think this kind of approaches can be kept as a second best scenario for emergency responses in the kind of cases where essentially you don't have other alternatives.
Okay, thanks. And finally, Juan, do you have any views on that topic? This will be our closing words as we're approaching the 2-hour mark.
Yeah, I definitely think it needs to complement the existing databases. As I showed in the presentation, the idea of just using digital tools really creates limitations for accountability, transparency, in terms of participation and in general in social rights. And it's important, and this question is super important because data is not a political, data is a product, it's an artifact, it's a construct, and this shows the political interest of the person that collected, created, and developed the whole system. So it's important to consider that these changes are not so, they are political changes, and they need to be considered always in how they change the social rights, the procedural rights of communities to access to social protection schemes. Yeah, thanks.
Great. Yeah, thank you very much for those words, those closing words. And I think that sums it up quite nicely. I think we saw a lot of really exciting and novel applications today. It's an exciting time. I think the COVID pandemic really brought out a lot of uses here, but as time goes on, we're increasingly faced with old dilemmas, old questions of accountability and transparency, and in that vein, I think there'll be a lot more to discuss going forward. I think GIZ for supporting this work, socialprotection.org for hosting us, and yeah, I thank all of the audience for joining us today. So thank you very much, everyone.
Thank you. Goodbye.
Thank you. Bye-bye.
Thank you so much. Have a good day.